Welcome to Tech Talks. I'm Holly Scott. I'm pleased to have as a guest today Danaë Delbeke, CEO and founder of Indigo Diabetes. Danaë has successfully founded and co-founded 7 high-tech photonics companies over the past 12 years, and she currently leads the Indigo vision and strategy. Thanks so much for joining us today, Danaë.
Hey, thank you, Holly, for inviting me to this Tech Talk and give me an opportunity to share Indigo's story. So thank you.
My pleasure. Perhaps we start with the why, right? Why Indigo Diabetes?
Well, Indigo's mission is to light up the life of millions of people by developing the world's first continuous multimetabolite monitor. So our continuous multimetabolite monitor has the ambition to give people access to accurate, real-time information on their key metabolites levels at any given time. So continuous monitoring of key metabolites may predict and prevent the early onset of diseases, anticipate the response to a treatment, unveil the impact of lifestyle changes or person's well-being. And Indigo CMM could therefore be the key enabling truly personalized healthcare as a first. And so it's Indigo's innovative technology that makes this approach potentially successful. So Indigo uses novel, groundbreaking nanophotonics technology to analyze the level of the key metabolites via a very, very small on-chip miniature optical spectrometer. So it's a super small sensor, so small that it can be inserted subcutaneously, avoiding the need for people to wear anything on their body. So there's no external device on the body. In the subcutaneous space, our optical sensor measures the absorption of light in the individual's interstitial fluids without traveling through skin or through tissue. And so by measuring directly in the interstitial fluid, we do not suffer from issues like tissue skin scattering or tissue skin induced variabilities. And on top of that, using that optical spectrometer, we also surpass the limits of the enzyme-based commercial CGMs that are today on the market, because we can measure multiple metabolites. So glucose, ketones, lactate, urea, pyruvate can all be measured at the same time. So both the fact that it's inserted under the skin, making it invisible, and the fact that it can measure multiple metabolites is a unique selling proposition there. So we do have a continuous metabolite sensor. It's a platform technology, but of course, as a small company, we need to focus, and we decided to focus on the diabetes market as a first application, because it's the market where it's known and where people have embraced the ability of continuously measuring glucose. But it's clear that lactate and ketones can add a substantial value in the diabetes management, and that's our mission, that's our why.
That's fantastic. I know you have an extensive background in photonics in particular. I'm curious about that foundation and 12 years in photonics prior to Indigo, that's substantial. So what helped lay the foundation there? What was it about photonics that drew you in, and how did that prepare you or introduce you, say, to the concept of diabetes?
Yeah, Indigo is founded on the crossroad of 2 fascinations. There's light and there's impact. So light is the source of all life, and using the light to make the world an even better place is what drove me and the Indigo team to found Indigo. Me, myself, I'm a photonics engineer by training and have combined that fascination for light and problem solving throughout my life. So I have indeed incited several other companies that are at the crossroad of light and impact. These companies are here working in Ghent, Belgium, on innovative applications using photonics, not in the medtech, so in domains like telecom, datacom, sustainable energy, smart materials. For Indigo, Indigo's foundation was triggered by the many conversations I had with people living with diabetes. And in these conversations, I noticed that our light sensor could substantially improve their quality of life giving them access to more than glucose only. So in an unobtrusive way, could give them access to glucose and other metabolites as well. And realizing that was the engine for me to make the impossible possible and lays at the origin of indigo.
That's fascinating. You make science sound beautiful, I must say. The intersection of science and light, it's a beautiful philosophy. As you have studied diabetes and understanding the history of people who are constantly, pricking their finger, and now we're in this wave of continuous glucose monitoring specifically, why do you believe that has become the current standard of care for diabetes?
Mm-hmm. Well, let's look first at the diabetes epidemic that we call. So according to the International Diabetes Federation, so 1 in 11 adults, or almost 500 million people worldwide, suffer from diabetes today. So it's a number that is even expected to increase by 50% over the next 2 decades. So it's a global disease. I think it accounts for 12% of the global health expenditure. It's the 5th leading cause of death. The global societal economic burden lies in the trillions, so it has an immense impact. Mm-hmm. And it's sad to know, but diabetes today cannot be treated yet. Mm-hmm. However, it is possible to fend the diabetic epidemic, as we call it, through self-management. So good self-management allows indeed people with diabetes to live a longer and healthier life, while substantially reducing also the economic and societal burden of their condition. And as of today, it's exactly CGM that is the cornerstone of that self-management of diabetes. So in contrast to the snapshots obtained by the familiar blood glucose finger sticks, CGM gives a continuous view on the glucose fluctuation, in which glucose trends play a very important role. So knowing if you're going up or down with your glucose is super important to anticipate hypers or hypos. And so numerous studies have demonstrated the enormous clinical benefit of CGM. So it reduces the glycated hemoglobin, so HbA1c, which is an indicator of good diabetes control and a predictor of long-term complications. So it reduces the HbA1c without increasing the number of hypoglycemic events, so which is an indicator of safety. So it is indeed the cornerstone of diabetes self-management, also having a positive impact on the health economic context of diabetes. So cost effectiveness is at the positive side. So that's seen by, that's the reason why national and regional reimbursement authorities, for example, are accelerating the reimbursement. So yes, CGM today is the cornerstone of diabetes management.
Yeah, I would imagine even beyond, there's the benefit to the patient managing their state. There's the benefit to the payers, avoiding the very serious catastrophic events and the backlash there. I would also imagine it gives the patient a sense of empowerment and control, which from a psychological perspective is critical when you're dealing with a chronic illness.
Exactly.
Yeah. So the multi-metabolite monitoring that indigo, that we're able to leverage with the indigo technology versus the traditional continuous glucose monitoring, what is the benefit to the clinician and the patient to see all of this data, this additional data, in addition to the glucose read?
Well, we have to look at it from a metabolic point of view. So metabolic systems, they rely on the provision of fuels, which are, of course, glucose, but also alternative fuels such as lactate, ketone bodies. So therefore, the ability to continuously monitor glucose, lactate, and ketones is expected to shift the target of diabetes management from a glucose-centric approach to a full metabolic footprint, considering alternative fuels also besides glucose. Lactate and ketones monitoring are of enormous relevance to understand and act accordingly. It's also those two metabolites that we are focusing on as a first in our application. So our multi-metabolite monitor will be measuring glucose, ketones, and lactates continuously at the same time. So for example, to give an example on lactate, so the impact of lactate in diabetes management. Lactate, as you know, when you go to sport, it acts as an alternative fuel for muscles during physical activity. And this mechanism is, however, largely impaired in people living with type 1 diabetes by the relative excess of insulin during hypoglycemia. So knowing the lactate concentration will help the closed loop systems of artificial pancreas in anticipating how insulin should be delivered to the person wearing a pump together with a sensor. Ketones, on the other hand side, is the key metabolite to monitor failures in insulin infusion system. As a rise in ketones might serve as an effective fault detection tool of an insulin pump. There's also diabetes ketoacidosis, which is a rare but potentially fatal metabolic crisis that can occur in people with type 1 and type 2. There's an increasing incidence of diabetes ketoacidosis also with the introduction of new medications such as sodium glucose co-transporters, SGLT inhibitors, which reduce effectively HbA1c and glycemic variability, but it increases substantially the incidence of diabetes ketoacidosis. So the ability of continuously monitoring ketone levels and provide alarms when ketones are surpassing critical levels is super important. So monitoring lactate and ketones along glucose will serve really that shift from glucose-centric approaches and insulin delivery treatments to a multi-metabolite footprint-driven treatment.
Which to me sounds like a much more holistic approach to the health of the patient without just concentrating on the impact of glucose alone, being able to get more holistic information and a baseline, so to speak, in different areas.
Exactly.
Wow,
yeah.
Fascinating. So this must have been quite a challenge from an engineering perspective to create this incredibly small subcutaneous sensor. What were some of the biggest challenges you encountered as the lead engineer and founder from the early days that you can share with us?
Yeah, so today we call ourselves a scale-up company. Indigo was founded in 2017. And during those early years of our company, we were challenged to integrate cutting-edge innovative technologies on a footprint of less than a square centimeter. So we were really combining those new technologies that had never been brought together before that. So technologies that have never been used in a medical device, never were combined in a small device. Mm-hmm. So Indigo, with the technical experts that we've that joined Indigo at that time from all the parts of the world, mastering all kinds of different disciplines, we surpassed those technical challenges and we made indeed the first smallest implantable sensor. We have a first in human study, was successfully ended last year. So we had done the first step with the technical challenges. Today, we are a scale-up company. So we are in the early stage of a clinical phase. And the challenges we are facing today are more with regards to translating the cutting-edge technologies, not only into a product, but most of all in an active implantable medical device. Mm-hmm. So going from research to product development is a challenge, especially when novel breakthrough technologies are used for complex application for the first time, like an active implantable medical device. So we have and are currently reorganizing and growing the team to add on top of those very technical experts, these skills that can develop an active implantable medical device product. So we are looking for people that have expertise in product development of active implantable medical devices using novel technologies. So I would say to the people who are listening to this podcast, feel free to contact us if you feel you can accelerate our road to the market. It would be great if you can join our team.
Yes, and it's an exciting time to join. That is certainly the truth. With our history in young companies, this is this is when things get really exciting, right? When you really are crafting and creating this market opportunity and bringing it through and pushing it forward. So
yeah, that's a super exciting time, especially with the new technology translating in a product. It's like, yeah, it's amazing.
it is. It truly is, and that is likely a hint of it. When you think about where Indigo is today, and this first to market challenge, this is exciting. What do you see as some of our greatest opportunities in the next several years?
So in the short term, all our efforts are really geared towards clinical validation of our CMM for those people living with diabetes. So this is definitely our first priority. Of course, over time, as said in the beginning of this interview, it's a platform technology. We're developing a continuous multi-metabolite platform that can also be expanded to other applications. So potential applications for continuous multi-metabolite monitoring systems encompasses a range of clinical and lifestyle use cases. For example, autoimmune diseases are disorders that are characterized by disrupted immune behavior leading to hyper or hypoactivation of immune system. So these diseases have specific metabolic chain reactions at cellular level, leading to a specific immune attack on a specific organ. But so measuring the metabolic response in the interstitial fluids could help to monitor and anticipate events, could help to get the treatment and dietary interventions in place, so to steer the impact that intervention to manage the immune disorder. So there's autoimmune diseases. Beyond that, there's other conditions that could benefit from continuously monitoring the multimetabolite concentrations, like progression in chronic diseases, monitoring risk of acute events such as early detection of stroke, monitor response, compliance to treatments, interventions such as dietary, how do we say it, life-changing interaction. So yeah, there's a great opportunity for CMM as such to support the management of complications, both in diabetes and beyond diabetes. And that's where I see the great opportunity of this technology.
That is fascinating, and that's exciting too. The immune area in particular, we're seeing incredible attention going towards the immune function and malfunction, and why we're finding that at the root of so many diseases once thought to be caused by other things. They're starting to realize that it's coming back to immune response, like even some neurodegenerative diseases and the like. And as you mentioned, chronic illness and management, I have a very close family member who has kidney disease, and part of the management of that is blood work, urinalysis very, very regularly, every 3 months, and just making sure that they watch their numbers. I would see, this is me thinking about it, but that sounds like kind of an interesting option for someone dealing with chronic disease.
Yeah, exactly, and it's only the beginning. So no, we don't even have a view on what the multimetabolites are that are playing a role in certain disorders. But today, multimetabolites and metabolomics is really something that's very hot. You bring your blood or any sample to a lab and they check out your metabolites. But imagine if you can really follow them real time, continuously, with the system in your hand. So I think it's going to open up a lot of potential interactions to manage different disorders there. So yeah, super exciting.
That is exciting. That's the next wave of innovation for sure, is getting this first to impact the billions associated with diabetes today. One of the largest killers of individuals. Diabetes is still a chronic illness that so many can't manage. So this is such a great potential opportunity. And I'm excited to be a partner with you as we look at the future of what indigo could bring, because this is truly exciting, Danaë. I really appreciate you spending time with us and sharing this.
It's my pleasure.
Yeah. Well, thank you again for joining us. It's been great to hear more about indigo diabetes and the excitement technology associated with it. And thanks for joining Tech Talks. We will see you next time. I'm Holly Scott. Be well.